So on Saturday at 2 o'clock, I'm doing a HESI Q&A. I do it for PNs and RNs. And what it is just overall concepts. Now, I've got some on my YouTube channel from when we started doing this a year ago. Listen to all of them because you know that I'm going to be saying things slightly different. And the concepts are always going to be there, the same sort of concepts. So go back and listen. I think the first one that I did was 1 year ago. So this time a year ago. And then every quarter, and there's 4 quarters per the year. So that's 4 of them already you can listen to. And then you could come Saturday. I'm going to be going over almost the same things, but I might explain things slightly different because I'm not going to have the same thing in my head. I might come up with a different example, etc. So study the Kahoots, study that Q&A. Also, another good thing is your NCLEX book, your Saunders NCLEX book on pediatrics. Go through it, read it. I've had some students say it was those HESI hints in that book that really helped them through the HESI. I've had other students tell me it was the Kahoots. I've had other students tell me it was the HESI Q&A. So if you do all of them, you got everything. And yes, I know it is a lot of work. And yes, I know you have 3 classes. So I understand it is difficult. So let's go ahead and let's start out with the Kahoots for uh, the review. Let me pull it up. Give me 1 second. Now, this is stuff that goes week 1 all the way through. Yes, it is comprehensive. I don't think it's crazy. I think that I make it simplistic enough for you to understand. But as I do this and I explain a little bit more about it, you'll understand what are those things I'm talking about. Like, what else could that question be asked? What is it asking? How else could it be, presented? I try to get you thinking there between the Kahoots that I do every week with you all and this HESI Q&A. I want you to think because, now it's not all about knowing and memorizing. It's taking those little bits of information that you know and now figuring out how does that apply. The hardest part of nursing is applying everything you learn, right? Uh-oh, Turbo's back. Be careful, guys. She likes to win. Here we go. So, as a review, I finished this last December. What is probably the single most important influence on growth at all stages of development? You all know this answer. Nutrition, nutrition, nutrition. If you don't, have enough nutrition, number one, that height and weight, you're not going to see it going up. And then you're going to see them not being where they should be on a cognitive level, whether it's speech, whether it's fine or gross motor skills, they will be delayed. There's no gas in a fuel tank. It don't work. How would you initially treat a 6-month-old infant diagnosed with GERD? When we feed GERD and we treat it, we're not going to be going directly into all of the types of medications. No. First of all, we're going to add rice cereal to the formula, but we're going to make sure they're burped well. They're sitting up after they eat and they're not being overfed. But that rice cereal holds that food down. During an assessment on a 2-month-old, you notice that the head circumference has increased 2 inches. What are you going to look at next? The head circumference is big. What else do you need to look? What other assessments? And infants are great. They've got the fontanelle. It's bulging. We know it's going to be a hydrocephalus. And know that these children will be, a little bit irritable. They will be vomiting because of the pressure in there, right? So this child, we're going to have to do something to get rid of the fluid. And usually that's a VP shunt. Frequent developmental assessments are important for which reason? Why do we want to know when they can turn over, when they can use their fingers, when they can walk, speak? Why do we want to know this stuff? Well, we know that if they're not where they should be, that we can institute interventions early. And the quicker we institute them, children are resilient. They're going to catch up quickly. So we can identify delays, deficits, and do what we need to do, catch them up. A multi. An infant just received their 2-month set of immunizations. Discharge teaching should include. We know that at 2, 4, 6 months, we load them up on immunizations. It's about 4 each time, right? A poor little infant. One of the things I always saw after immunizations was they get these low-grade fevers. Plus, sometimes that vastus lateralis gets really hot and hard, and we know it's discomfort. So, given that a Tylenol, now no Motrin on an infant until they're 6 months, right? And also a cool pack helps. And they say after we give those immunizations, pedal the legs. What it does, it moves the muscles. It gets that stuff going around. It moves it so it's not just sitting there creating inflammation. That pedal the legs is probably the most important. It's what I do after my immunizations. I move my arm up and around, and it helps. It really does. The head to tail direction of growth is referred to as what? It's called cephalocaudal. Cephalic, right? And caudal is down to the feet. It is lifting their head up and then down to walking. What is the single most important factor to consider when communicating with children? If you work in an ER like I did for the last 10 years, you've got a short window of time to be able to get in there and to do what you have to do for a child. And I have become very creative in what that I have done, but it's getting on their level, sitting below them, never towering above. I mean, stickers, I'm telling you, they're the best thing since sliced bread for kids. Have a Batman sticker or a princess sticker, the kid will do anything you want. What 2-year-old pain assessment tool should the nurse use? 2 years old, toddler. And this is the one that we also use for nonverbal children. Because a 2-year-old, can they really express where their pain is? Not really. It is the flack at this time. It becomes faces at 3. Preschooler at 3, okay? So infant up to the age of 3 is flack, and all your nonverbal children. There's some kids who do not talk, a non-talking spastic cerebral palsy. And I know quite a few kids, they don't talk. eyes. What teaching should the nurse give? Remember, there's drops and there's ointment. Why did I say ointment here? Well, when you put ointment into an eye, it makes your vision all blurry. And I'm telling you, children, even adults, be like, what's going on? I can't see. Oh, the medicine is not good. Let them know your vision is going to get blurry. According to Erickson, school age children have a prolonged hospitalization should be offered what to promote industry? Remember, industry is their house, their building, is what they can build, right? Prolonged hospitalizations, they're in there a long period of time. You got to keep them stimulated. But remember, when you do that, it has to be a task that the child can do, right? It may take a little work, but they can do it. They can accomplish it because the other part of industry is inferiority, right? They can't do it. They feel less than. So make sure that we give them a task that they can complete. Not so easy, but they can complete. What is priority treatment for a child with dehydration due to profuse vomiting? Dehydration, signs and symptoms. Elevated heart rate, decreased blood pressure, no or little urine output, prolonged capillary refill. I mean, all of these things, sunken fontanelles, all of those things. And if they're vomiting, you don't want to give anything by mouth, right? So replace them with an IV and then give them an antiemetic and slowly introduce oral. And yes, oral electrolytes. The first expected fine motor developmental milestone for an infant begins with what? Remember, F, fine fingers. G is gross, get up and move, go, go, go. So the first thing is that reflex. Remember, mom puts your finger in the little crib and the kid grabs it, goes, oh, look, my baby's hugging me already. Don't ever tell them it's a reflex, right? So it starts with a reflex and then it becomes voluntary. They grab the rattle from you eventually. An 8-month-old infant should be expected to perform which fine motor skills? So fine motor, we start with that reflex. Then we go into voluntary. Now we're talking 8 months. So they've already done voluntary. What else they going to start now? So they can grasp it. And now they're using that crude pincer. It gets to be the fine where they could pick up the little Cheerio. But initially it's sort of like a smush. It's a crude sort of pincer grasp. Yes. Then it goes up into refined pincer grasp. Then it's taken, putting objects into a container, and then it's building a block of 2 by 1 year old. That's all your fine motor. In general, an infant should triple their birth weight at what months of age? And it's 12 months old. Tripling at 12 months. Why do we need to know this? You could get questions about an infant who weighs 7 pounds at birth, and at 1 year old visit, the child weighs 16 pounds. Is this normal? Well, we know that's not enough. You'll see questions turned around like that. So an RN is assessing a 2.5-year-old toddler should report what to the provider? That means something here's not right. Which one of these is not right? At birth, infants are born and they have a huge head. And then right about a year and a half, the chest and the head should be equal. If at 2.5, that head is still bigger than the chest, it could be hydrocephalus. It could be a brain tumor. It could be something. It's not right. That needs investigation. A mother of a 3-month-old infant is concerned because her infant's head is flat in the back. How would you respond to that? Well, we promote sleeping on their back, supine, right? Because we want to decrease the incidence of SIDS. It's sort of normal, and they have soft heads, right? So, what we tell them is tummy time. When they're awake, fully awake, they can be on their tummies, and that little bit of time, a couple times a day, does help that head shape what it should because it is very soft, their scalps at this point, and it will remold easily. A 2-month-old infant has cradle cap. What should the nurse tell the parents to treat it? Cradle cap is that white, scabby, flaky material. It could be a little bit, it could be a lot. Now, you still need to wash it, but you take a fine comb and just brush it out. It's not going to go away with one time. It will take a couple times, but you need to help it move it by a fine comb, but very easy, all right? There was another book that I had read that said putting olive oil at night and then washing it off and do their bath in the morning, the moisture helps. So, but the book says wash it with water and a fine comb. What information about introducing solid foods to their 6-month-old infant would you offer? How do you offer foods? Because the first 6 months, they're just having breast milk or they're having iron fortified formula. And at 6 months, they're old enough to start introducing foods. Now, our concern is allergies. So, one at a time, 4 to 7 days in between, offering a new one. And they say rice cereal is the less allergenic, and you should start with that. Usually it's recommended. So, according to Kohlberg, pre-conventional level of moral development, a preschooler who has moral reasoning what? What does Kohlberg say? What is he all about? Morality. Well, what is morality? So Kohlberg is about right and wrong, and then there's a consequence. As they get older, they know the right and they don't want to do wrong. They don't want to be punished. But the younger kids, they have to know there's a good consequence and a bad one. It's that starting of understanding about right and wrong. Which nursing action is appropriate to teach a preschool age child about a scheduled procedure? So preschool kids, ages 3 up to age 6. Now, you take a kid, explain it, they don't understand. Give them a doll, a teddy bear, something they like, work with. Could be a boy and a dinosaur, it doesn't matter. But just show them what's going to happen to them. And it makes it less threatening. And they know what to expect. Before performing a physical assessment on a toddler, the nurse should do what to encourage cooperation? Toddlers ages 1 to 3, they don't really like nurses. What do we do every time they see us up to this point? We give them shots, right? Injections, immunizations, or something to drink, and they don't like that. So if we have to do a physical assessment, number one, get down on their level. Do not stand above them again. And then let them touch, let them play. A toddler, a 2-year-old, knows numbers 1, 2, 3. So say, here, push the button. My number's a 6. What's yours going to be? Or can you help me do this? And they're more than willing to do it. And now it becomes a game. And now they're going to do whatever you want. And then, of course, I have a sticker when they're done, right? In terms of language and cognitive development, a 4-year-old child would be expected to do what? Cognitive development, that's thinking. Infants take that rattle and it moves and it makes a noise and they go, "Oh, I like it," and they shake it. So they've learned from these things. Well, a 4-year-old, a preschooler, where are they and how do they understand? Well, a 4-year-old can follow simple commands. Oh, go get your shoes and put them where they belong, right? Oh, go get the towel off the floor in the bathroom. Go put it in the laundry. They understand this. And actually, they want to do it. They like to please and help mommy and daddy at that age. Parents are concerned their 8-month-old child's not developing like their older child. What is normal for 8 months? So by 8 months, they should be able to sit alone unsupported. Can they pull themselves up to sitting position? If you sit them there, they can do it. They're not completely pulling themselves up, but absolutely sitting alone unsupported 8 months, yes. An infant presents signs of dehydration, hunger, and an olive-sized mass in the right upper quadrant. What would you monitor for? They're dehydrated and they're hungry. And they've got that little marble, that little olive. What is that? And what symptoms of that? And this is, be careful, projectile vomiting. They're going to get you if you don't catch them and tell these parents or grandparents, please don't feed the baby anything else. That olive-sized mass is the pyloric sphincter. It's muscular, it's hypertrophic, okay? And they're vomiting all their food away, so they're not getting hydrated. And the food's being vomited. They're hungry. And they just keep eating, eating, eating because they're hungry. And I would say, are they vomiting, right? A multi. What would alert the nurse to hold the digoxin on an infant she's caring for? What do we know about digoxin? We've studied it in pharmacology. You've seen it in med-surg. Well, here we are with an infant. How can an infant tell you these things, right? They don't speak. They can't say yellow spots in front of their eyes, right? But you could check a heart rate, you can check their lab values, and if they're vomiting, I would not give digoxin to an infant until I called the doctor and got a level. Even if it's just vomiting, I'd rather be safe than sorry and causing dig toxicity. Very good. When taking an adolescent's health history, which is most important? Remember adolescents, right? They're at that age looking for their own identity. There's conflicts between parents and the child. And with me, I wouldn't have said anything in front of my parents because I'd be too afraid. I'll be punished, right? Get the parents out of the room and speak to that child, that adolescent. They're going to tell you things that they wouldn't say in front of the parents. And if it helps them with their health, is what we need to do. I tell the parents I can't tell them what the child said, but if it was something that could hurt themselves or others, that's when I would say something. And that's hard for a parent, but at least now we know how to treat the child, right? A multi. A 13-year-old status post-umbilical hernia repairs complaining of swelling, severe pain, and vomiting. What can cause this? So they've had abdominal surgery. Their abdomen's swollen and it hurts. And they're also vomiting. What are these signs and symptoms telling you what's going on? And this is all that manipulation and surgery, pushing intestines back in, putting a mesh there. It's a paralytic ileus, and it's that abdominal swelling, severe pain. And when you see vomiting, it can't go down, so it comes back up. Very good, guys. A 4-year-old is reluctant to take medicine. What intervention should the nurse take? These are preschoolers. They understand. You can talk with them. And you don't mix it with medicine, food, or juice, especially if you don't know if they took the whole dose. The best thing is that straightforward approach. And by this, I mean, would you like a pill you could chew? Would you like a liquid? Do you want it in a cup? Do you want it in a spoon? Do you want the orange one or the red one? Okay, that's straightforward. And that's enough of a choice that the child feels that they were a part of taking the medicine, not just here, take this. Which concept reinforces the development of a sense of trust for an infant? So we're talking about Erickson here. So, what does an infant know? They know if I cry, somebody comes, gets me, changes my diaper, and feeds me, and I feel great. So, if I cry and there's trust, they know. They can predict somebody's going to take care of what they want. The mistrust is when the parents don't come and get them right away and leave them crying. And it gets to the point where the infant actually stops crying. They're like, well, nobody's coming. Why do I want to keep crying? An infant is NPO, unable to take breast or bottles for feedings. What's important to remember? This was mentioned with tracheoesophageal fistulas, esophageal atresia, Hirschsprungs. I mean, they can't eat because of their conditions. What do we always need to remember? For proper growth and development, right? It's the pacifier. If they're NPO, we're not going to put nothing in their mouth. If you put a little formula on their tongue and it was esophageal atresia or tracheoesophageal fistula, it will go right into the lungs and now you caused an aspiration. So, NPO, pacifier. When teaching sex education and contraceptive for adolescents, what should the nurse consider? So, contraceptive for adolescents, they have a right to be in charge of their care, right? They could go to Planned Parenthood and get things. As a nurse, what you do is give them oral and written information. You don't give your bias. Well, you should be abstinent. An adolescent's going to do what they want. They want education. Oral and written is what you do for them. The monthly immunization for RSV. So RSV is a virus. So palvizumab is what we give the synergist. Now, HIB is your hepatitis. Humira is used for your rheumatoid arthritis. And indomethacin closes that patent ductus arteriosus. It's synergist. It's always a question you see on the exam somewhere, somehow. An infant with a hypoplastic left heart's becoming tachypnic, taking a long time to eat, and requires rest. What assessment is priority? What's going on? What is this telling you? They're tachypnic. It takes a long time to eat and they need rest. What is that telling you? You already have a bad heart, so this is going into failure. Listen to the lungs. You're probably going in congestive heart failure now. And then on top of that, a recent sudden weight gain would also be part of that. When doing an admission on an infant with a low-grade fever and a loose cough, what information is priority for placement? So you're the nurse who gets the call. We have an infant who needs to come in. We need to place them somewhere. And you don't have all private rooms. Where are you going to place them? Because you don't want to pass on from one kid to the other. And the most important thing is the immunization status. If they have a fever, loose cough, is it pertussis, right? Or is it just a normal upper respiratory? Your immunization status will say they've been protected against this. Okay, these two infants can go together. When administering antibiotics for a child with pharyngitis, what would you monitor? So, kid has a sore throat, you're giving antibiotics. What do you need to monitor with that? Well, the one thing that we do always first with any administration of meds, especially antibiotics, is looking for that allergic reaction. Now, if we're in a hospital and we have lab results, we would be looking at those WBCs. Are they coming down? And with a sore throat, you're not going to go and look at the oropharynx. I don't want to cause more swelling in there. When teaching a parent of a newly diagnosed child with acute lymphocytic leukemia, what are the early signs of an infection? Now remember, ALL is immature white blood cells, which means they don't have an immune system, right? So knowing those signs will get that child to treatment quick. Now, any child immunosuppressed are told if they have a temperature, rectal temp of greater than 100.5, they need to tell their doctor. They're immunosuppressed. Their system can't handle an infection or fever. You're going to see that question asked many different ways. So ALL, no white cells. All right, we need to know. And that's one of the teachings we need to teach the parent and the child. A 3-year-old's brought to the ER with increased wheezing for the last 2 days, and that child does use that meter dose inhaler. What information is important? What do you need to know? Their wheezing is getting worse and they have an MDI. It's a 3-year-old. And this was one that, yes, how are you giving the medicine? Are they really getting it? I mean, a 3-year-old, if they don't have a spacer, they don't know how to push the button and inhale. So the spacer would make sure they got the dose. A multi. What is included in the plan of care for a child with cystic fibrosis? Remember, cystic fibrosis is two systems that it affects. It affects lungs and it affects digestion. So when you're considering a plan of care, both are just as important. So the child is not absorbing fat, so they're losing calories, right? So they need pancreatic enzymes to help them with that. They're losing salt through their skin. So you would never put them on a low sodium diet. In fact, give them a salt shaker because they lose that much sodium. And we're going to give high protein, which helps in healing. And then we're going to treat the chest, aggressive chest physiotherapy. Give that albuterol, that dilator, then do the chest CPT. It'll open it up and get rid of more secretions. Which information is the most important when rheumatic fever is suspected? Well, what is rheumatic fever and how do we get it? And what do you see? So, rheumatic fever is due to a pharyngitis or a strep infection that wasn't treated. And in rheumatic fever, there's all things sore throats, you would see rashes, joints to be swollen. It also can affect your heart. It also can affect called chorea, which is weird movements that you can't control. Everything can be reversed except for the heart valve, and it's usually the mitral valve that gets affected, but everything else can be reversed. A multi. What are some assessments that an infant would have if they were in acute respiratory distress? An infant, what would you see? So infants would be tachypnic, they'd be retracting, but the two things that are specific to infants is nasal flaring and grunting. And respiratory rate 34 is normal. It should be in actually respiratory distress, it would be above 60, right? And even the neonate is 40 to 60 is normal. A 1-year-old, 60 respirations per minute is a lot. So it's not the 34. What is the purpose of giving indomethacin to a neonate with a patent ductus arteriosus? What does indomethacin do? What is indomethacin? So indomethacin is that stuff that stops the prostaglandins, which is keeping that duct open. Now, mommy usually is the one who produces that hormone when they're inside mommy. Well, then the baby's born. Usually it stops. There are some infants that somehow still have enough in them that keeps it open. It's that prostaglandins which keeps that vessel open. The indomethacin says, no more, you're done, and it stops it. It inhibits that prostaglandins from being um, produced, and that closes the PDA. And that's why they normally close normally, because usually mommy has it, but some infant can produce it. How do you get an adolescent to open up about their sexual history? So you start out that distracting like you do with a child, the young infant. So, tell me, I see you have a sports shirt on. Do you like baseball or you're listening to music? What music do you like? And then you're not as threatening. Kick the parents out, right? And then many of them will talk to you. And as I've told you before, be careful. They are going to say some things that they like to shock you. What is the greatest risk factor for a newborn receiving a cardiac catheterization? And probably, you have a congenital heart defect. All of them will get a cardiac catheterization. And there are these tiny little babies, these big vessels, catheters we have to put in. And our biggest concern is hemorrhage. As I said, first thing you need to check when they come back is the dressing, making sure there's no hemorrhaging going on, because they'll hemorrhage out really quick. What symptoms exhibited by a 3-year-old child with croup is a priority concern? What do we know about croup? We know croup is respiratory and they bark, but croup left unattended turns into epiglottitis. Therefore, swallowing secretions is what the priority concern is. When they can't, they're going to epiglottitis. A child goes to the ER with respiratory distress. They're anxious, leaning forward, and drooling. What action is priority? What do you think's going on here? Now, usually the aerosol we would start on this is actually racemic epi, trying to get it right down to where the epiglottis is to try to decrease the swelling. But it's airway, airway, airway. Make sure there's something that a physician can open an airway quick, whether it's a trach tray or intubation. A 10-month-old status post VSD repair, AM meds. This is their vital signs and what meds should the nurse question? Blood pressure 118 over 70, 99, 88, 22, which is not right. So a 10-month-old's heart rate should be above 100. This would be one that I would question. 88's a little bit lower. If they're in the hospital, I'd be checking potassium and dig levels, and I'd be notifying the doctor. While assessing a newborn infant, you notice decreased femoral pulses bilaterally. What nursing action should be next? I've gotten a lot of infants right out of delivery, right into the NICU, into the nursery. And we would do our little assessments. And I actually found one of these. And it was like, oh, I don't feel undersalus pedis. Oh, I don't feel any femoral. Immediately, I did 4 extremity blood pressures. The upper are going to be higher than the lower. Very good. Coarctation of aorta, multi. When educating adolescents about HIV and hepatitis, what would you include? So we can tell them not to have sex. They're going to do what they want anyway, but we can say it. Of course, if they're going to have sex, condoms they need to have on, and hand washing is always there. And I hope they're taking showers more than every week. What discharge teaching would be needed for a toddler diagnosed with hemophilia? So you've got a 2-year-old just diagnosed hemophilia. What is hemophilia? They're missing a factor, which means if they're cut, they bleed. What's your concern? Taking care of the home environment. It could be the coffee table, right? It could be something that's sharp, making sure everything is either getting rid of or you pat it in some manner. Protect them. Multi-select. A child with hemophilia has fallen, then he is swollen and painful. Treatment would include what? Remember, that joint sac is filling up with blood and it's caustic to the joint and can cause those joints to be really damaged. And we don't want them to be crippled because of this blood in there. So it's rice. We're going to rest, ice, contain, and elevate. And it's no hot packs, cold packs, because we want to constrict it. And then if they have home factor, they need to get the home factor to stop the bleeding. Discharge teaching for a child with cystic fibrosis about their respiratory secretions should include what? Well, the one thing about respiratory secretions, they get thick and they're like a petri dish and they grow bacteria. So we want to keep them loose. So yes, percussion, postural drainage, TID minimum, and of course, all the aerosols that are ordered. And the aerosol should be given before we do that postural drainage and CPT. Your child with leukemia has had recent lab results and the platelet count is 10,000. What does this mean to you? A platelet count of 10,000. And let's say any child with any condition has a lab result. Platelet counts 10,000. What is your concern? This child is at risk for bleeding. Platelet count should be 100,000. 10,000 means this child is going to maybe have gum bleeding. You need to inspect, petechial rash, bruising. This child we have to watch very closely. A child starts with a nosebleed for no reason. What action should you do first? Nosebleeds, what do you do? As I said, a lot of times nosebleeds or epistaxis is that first thing that we see in a child that has bleeding coagulopathy problems. You take your thumb, forefinger, push it, and push them forward so they don't swallow it back for 10 minutes. And if then it's still bleeding, they need to get to an ER. They need care because something's going on. They need that bleeding to stop. An 8-year-old semi-conscious boy is brought into the ER with blood sugar 600, pH is 6.8, pH 7.12. What are you going to do first? What's the most important thing? That's DKA, isn't it? Look at that pH. And the potassium's high. It's all about, the electrolytes. It's all about the blood sugars. Number one, you need to bolus. You need to dilute that blood sugar. And as soon as we can, start a regular insulin, slow, continuous drip. And then we don't correct bicarbs. We don't give bicarb amps to them. No, we don't. What we do is just correct the blood sugar, correct the fluid balance, and we will see that child all of a sudden perk up and even look better. A child submitted with hypoparathyroidism. What findings would you see that needs to be reported to the healthcare provider? What is a parathyroid? What does it regulate? Hypo is what? Less than. Less than what? This is all about parathyroid calcium. Remember, calcium, magnesium have everything to do with muscle contraction. If you don't have enough, you're weak. It doesn't, want to spasm the way it should. It doesn't contract. And conversely, hyper, you're in tetany. You can't move because it's in a complete spasm. Parathyroid calcium. So a 2.5-year child status post epispadias yesterday wants to play. What would be appropriate? What's an epispadias? What sort of surgery do they do? And what is your biggest concern? It's a toddler. They're 2.5. Yes, put a puzzle together. There literally is still a catheter left in their penis after they do this big plastic surgery. And they fillet that penis open. That's how severe it is. So this catheter's left there. We don't want anything to hurt it, touch it. All the other stuff, something could happen and go into their privates and it could create problems. Very good. A child with Kussmaul respiration due to DKA. The increased respiration is trying to compensate for what acid base alteration? Well, DKA has what? The body is pretty cool. It tries to correct stuff for itself. So the child is in metabolic acidosis. What happens is they try with their respirations, put themselves into respiratory alkalosis to blow off acid. It tries to equal it out. So it's the opposite of the metabolic acidosis. When talking with an adolescent regarding personal health concerns, what is most important? So in adolescence, let them talk to you and be open and honest. And again, try not to have that shocked look when they tell you some things. In school age, conflict of industry versus inferiority. What does industry mean? So how do I describe industry? Industry is their house, it's their building, it's what they can do, and they make it well. And it's mastering a task, whether it be spelling, whether it be sports, whether it's playing a piano, whatever it is, they do it well. And that's their house. They're proud of it. The inferiority is what they can't do well. A multi. A child with a rash, fever, joint inflammation has rheumatic fever. Teaching should include what? So, rheumatic fever can cause heart valve damage. It is a strep infection and it will require long term antibiotics. They say they do prophylaxis up to 5 years later, believe it or not. And heart valve damage never improves. Once it's damaged, it's damaged. Contraindication to administering the varicella vaccine to an adolescent. So let's look at varicella vaccine. It is a live vaccine. When do you give a live vaccine? Well, we know the immunosuppressed person shouldn't get live, but who else? And that's the child who's on steroids because they are rendered immunosuppressed with the steroids. Okay, that's a question you'll also see in med-surg. Early detection of a hearing impairment is critical. Which one is of primary importance? Hmm. Remember, hearing goes right along with speech. If a child is not speaking right, number one, do a hearing test, making sure they're hearing good. In helping a child to adapt to a hospitalization experience, the best approach is what? Routine is the biggest thing. Children like to have the same foods if possible. They want bath time the same, nap time the same. If you keep it the same schedule, especially toddlers, they do much better at the hospital. When assessing vision on a child, the healthcare provider would use a Snelling chart at what distance? So it's at 20 feet. And in children, we don't necessarily use letters. We can use all different things, whatever age appropriate is for them. Could be animals, it could be shapes pointing up and down, whatever works better, we do. Referrals for cognitive impairment should occur when child's not doing fine motor, gross motors the way they should. The kid's not walking when they should. They're not talking the way they should. And you're going to start it as soon as possible. And as I've said, children catch up quickly. Just catch them as quick as we can when we're noticing delays. How would you help encourage a preschooler to be less apprehensive when taking their vital signs? Preschoolers, ages 3 to almost 6. They're pretty smart cookies at that age. And again, playing with the equipment, just like toddlers. Toddlers like to play with it, so do preschoolers. What acid base imbalance you might see in a child having profuse diarrhea? There was one HESI that had 4 different acid base questions on. So, one of the things you should know. So, if you have diarrhea, all of those enzymes which help and aid in digestion are all alkaline. So, you're losing alkaline with diarrhea. What is left? Acidosis. Now, if you're vomiting, what are you vomiting? Gastric acid. So, your acid you're losing. What is left? Metabolic alkalosis. That's how you remember both of those. A parent calls because her child is exposed to a child that now has chicken pox. When are they contagious with chicken pox? It's 2 days before the rash appears and then until all the lesions are crusted. If those lesions are ooey gooey, they're contagious. And then before the rash, 2 days before. And that's usually when they spread it. What is the nursing priority preoperative intervention for a child with Wilms tumor? Remember, that's the kidney tumor, nephroblastoma. Be careful with that abdomen, right? Do not palpate abdomen because there's little microemboluses. And as I said, they don't even do a pre-op biopsy because that will also do the same thing. It will put metastasis in the peritoneal cavity. So do not touch, no biopsies. A multi. If an infant is not past the meconian stool in the first 24 to 36 hours, what would you assess for? We've learned about all of them. We've learned about them all at separate different times, right? Hirschsprung's disease, they're not going to stool, maybe a little ribbon. Cystic fibrosis, another one, and hypothyroidism. Electrolytes, we're not even concerned. It's the stool. Why aren't they stooling? Those are the big 3 that they'll be testing for. A child with sickle cell disease would most likely exhibit what signs and symptoms of a crisis? Remember, all those cells get stuck at a bifurcation and stuff don't go down, and it just keeps swelling, swelling, swelling. It's pain, 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 pain. Now, that's the sign and symptom. What is it due to? Probably dehydration. So, what is the priority treatment? IV fluid bolus, dilate the vessel. Okay? When teaching the family and child about celiac disease, which of these food items is allowed? And it's rice. Yes, it is. A child stepped on an old nail while playing outside. What action should the nurse do first? First of all, you're going to clean it. All right. Clean the area. I mean, giving a tetanus booster first or second, it doesn't delay it. It's not like other stuff that we should do first. Clean it and put some antibiotic ointment on it. And even if they get tetanus, you're still going to clean the wound that caused it. Very important. A 6-year-old child goes to the ER due to abdominal pain, fever, and vomiting for the last day. What assessment's priority? Like, what do you need to know about this? And it's where is that pain? Is it in the umbilicus area or is it a an appendix, right lower quadrant? Very important to know where the pain is. A 5-year-old fell off the monkey bars and is crying because of pain in her arm. What action should be done by the nurse first? What is the most priority, the biggest concern? And it's all about blood flow. Did the swelling occlude blood from going down to the fingertips? So checking capillary refill, very much so. That you check. Are we going to check pain level? Yes, but number one, do we have circulation? We don't want to lose an arm because we didn't check that. What is one way to help detect hypo or hyperthyroidism in children? I've said this about at least 10 times this quarter with y'all. At least. We know hypothyroidism is all about growth and cognition in children. So recording height and weight, we can see, are they gaining or not? What would be the most important to report to the healthcare provider for an 8-year-old status post appendectomy with NG tube suction? This is a tricky question. You sort of have to know what the thing is here. Neutrophil counts of 400 means there's absolutely no defense against infection. Okay. So you've got status post surgery. They can't fight infection. That is your worst. An NG tube output, we can always replace it. Neutrophil count, we've got to treat an infection. Prophylactically, we're going to be starting or adding another antibiotic. A multi. Signs and symptoms of hypertrophic pyloric stenosis. Pyloric stenosis, projectile vomiting, and that olive-sized mass there. And these kids are hungry. They want to eat. They don't have poor appetite. They're not getting food. They're screaming for food. A multi. A child with chronic kidney disease has renal osteodystrophy. What outcomes would you see? So osteodystrophy, what does that mean? Break the word apart. I mean, we know the kidney does a lot of things, but osteodystrophy is all about bones, and dystrophy means it's not growing right. So we know bones need vitamin D, And we know it can cause that crooked bone, slow growth, and it could be bone pain. Very good, guys. It was a hard one. You suspect an infant has cryptorchidism. How would you examine this infant? What's a cryptorchidism? Put them in a warm room so that the testicles can hang and you get a better understanding if the testicles are there. Multi. What teaching would you give parents on how a hypospadias is corrected? This is the one we did with the child. What would we allow them to do, right? Hypospadias. I mean, they fillet the penis open and they create a canal because that hole is on the bottom. It's not where it should be, right? We need to know that foreskin, they can't take it off, they can't be circumcised. In some religions, that's a big deal. And they do put a stent there for 7 to 10 days post op, and we do nothing with it. Almost children with nephrotic syndrome are often given albumin and Lasix for fluid overload. What would you see if you gave albumin and Lasix? Nephrotic syndrome, all of the protein is gone, right? The kidneys are getting rid of it. Fluid is going extracellularly, right? Interstitial. So, what does albumin do? Pulls it back in to the intravascular. Lasix comes by and it makes you urinate. If we see increased urine output, a decreased blood pressure, and then the edema, because it's now being pulled back intravascularly. Very good. Yes. What lab value on one of your clients makes them a priority for you to see first? You get a group of, patients for the day, and you're looking through them quickly and you see this lab value. That one's going to be the first one, and it's that neutrophil count again. Neutrophil count of less than 1,000, 1,500 is dangerous. That one I want to make sure, do they have a temperature? That one is going to need special care. You don't want them to go into septic shock on you. A multi. An adolescent with a BMI of 90% is complaining of frequent urination. What tests can you anticipate the healthcare provider doing? Adolescent overweight and is urinating a lot. We're going to do a urine and look at it. Electrolytes, because they're urinating a lot. This is probably the beginning of diabetes. So, yes, hemoglobin A1C. What teaching should be done for an adolescent with Hodgkin's lymphoma getting chemo and radiation? What sort of teaching should they receive? Is one of the things that they need to be told, as we're doing the treatment, and it's all about the risk of infertility. This is not like cystic fibrosis. We can do bilateral lung transplant and then a male can have or be able to have a baby. But this is the infertility that it doesn't change. It will be, they can't have babies. A child falls in a thick bush and he's covered with prickers and complaining of severe eye pain. What are you going to do? We're concerned about that eye pain and prickers in it. And especially if there's something in that eye, patch both eyes and get them to an ophthalmologist. Now, I do have 14 more questions. It is 5:15. If you must go, you're more than welcome to go. If you want to stay, I'll keep going. So that's up to you. A 2-year-old goes to the ER with an inconsolable crying and a painful abdomen. What finding shows you this is a medical emergency? 2-year-old, painful abdomen, and there you can't console these kids. And its current jelly stool, this is probably intussusception. And it's like sudden onset of abdominal pain. And you can't console them no matter what you do. When assessing a 2-month-old with vomiting, what questions should you ask the parent? Remember I said any infant comes into the ER, there was one question I always ask. Is it dribbling or is it across the room? And that will tell me, is it reflux or is it pyloric stenosis? You notice a 2-year-old child with congenital heart disease, their heart rate is decreasing. What other information is important to report to the healthcare provider? Something's going on there. It's the blood pressure. Actually, that urine output is normal. It's the blood pressure. That 2-year-old, that is the first year of life blood pressure, not a 2-year-old. What priority procedure will you anticipate for a child suspected of having Kawasaki disease? Remember, Kawasaki is systemic vascularitis. And our biggest concern is when we have aneurysms, and those aneurysms are on the coronary arteries. It's the echo. Those children get an echo as soon as we can. EKG won't tell you, so it's the echo. Make sure those coronary arteries are good. Multi. Why do we give aspirin therapy to a child diagnosed with Kawasaki disease? Remember, systemic vascularitis. We give aspirin to prevent clots and decrease inflammation, right? And that was actually off of a HESI. A multi. What lab test should be monitored for a child with congenital hypothyroidism? What are you concerned about? And this one, you just have to know what the thyroid hormones are: T3, T4, TSH. The other one's growth is the pituitary, and luteinizing hormone has nothing to do with the thyroid. A multi. When entering the room of a child, the child becomes stiff, the arms and legs start shaking. What is your priority action? What's going on here? Sounds like a tonic-clonic seizure. Stiff, the arms and legs. Again, of course, you're going to notify a team. You're in a hospital. Turn them to the side, protect them, pad, the rails, take the pillow out, lay them flat. And of course, knowing what time it has been going on for. A 3-year-old boy with a waddling gait and falling is admitted for testing. What procedure can you anticipate? Waddling gait and falling is telling you there's muscle weakness. Remember, there's something called Duchenne muscular dystrophy. This is that 3 to 7-year-old boy that will see it. Now, how do we diagnose muscular dystrophy? And that's the EMG, electromyography. It measures you put a little shock in by electricity and seeing, does that muscle move with it? Remember to tell the child and the parents when they come back, it feels like they ran a mile. So they're going to have some muscle weakness and tenderness, that it's only temporary. A mother calls the clinic about her child. She's playing in the woods and now has a rash that is spreading. What over the counter medicine would you give to this child? Playing in the woods and has a rash and it's spreading. Over the counter? We are not giving that kid anything over the counter. Could this be ticks? Could this be something else? So this is a case that a rash and it's spreading more. It's not just a localized, it's spreading. They need to get medical attention. A mother calls the clinic and a friend of the child's has ticks From playing in a field, what do you tell the mom to do? My kid's friend has ticks. Is there anything I need to know? Mhm. So the one thing that you do if you suspect ticks is number one, examine the body, right? Look everywhere for them. Not scrub them, none of those things. Just look first. And if you see them, then you tell the doctor we'll order some creams. What shouldn't you do to a child diagnosed with impetigo? This is a really contagious staph infection. Little Christian had this. And it's open, juicy wounds. We don't want the juice to be open because it spreads like that. And as a nurse, make sure you use gloves and you wash your hands because it will spread. An adolescent goes to the school nurse complaining of ringing in her ears. What exam should you do first? I mean, we know it's because they're playing music in their ear all day long, right? They're always on the phone, right? But first of all, look in there, see if there's anything in the ears. I have seen things like roaches, I've seen a bee, and I've seen all sorts of things, but they can cause that buzzing and ringing in the ears too. Multi-select. An infant's being discharged after 14 days of vancomycin. What teaching should be included? Well, what is vancomycin? What are concerns about vancomycin? What are side effects of vancomycin? It's an aminoglycoside, right? They're very powerful. And we know that it attacks kidneys and we know it attacks hearing. So we're going to make sure, is the child still hearing at home? Okay. Also, making sure that they're having wet diapers, which means that their kidneys are functioning. And we made it. Last question. When checking the lab values of a child with hypothyroidism, what lab values would you look at? D3, D4, TSH, yes. All right, let's see how we did. I know some of you stayed. We have a JP2, number two. Oh, there I am again, BB, I won. And number one, Turbo. I told you she's dangerous. And Miss Fig and Morgan. Good job, guys. So please try to come to my question and answer. If you can't come, I understand. There's a lot of stuff that you all have to do, but see what you can do. If not, please listen to one of my previous Q&As that are on my YouTube channel, okay?
Can
Thank
I
you,
ask you a
guys.
question?
Absolutely.
Do we come to class after we take our